Hey, sports pharmacists. This is Ashley with the International Sports Pharmacist Network. Today, I'm so excited to have Mikko Lemettila, you can correct me on that, joining us to do an interview about his job and his role in sports pharmacy. Welcome, Mikko.
Thank you for inviting me, Ashley. And the name
Absolutely.
pronunciation was very good.
Yep. Sooner or later, I will get there. It takes some practice. Yeah.
Yeah,
And I know a lot of people already know you from your social media platform and all the really educational posts that you put out there. But please introduce yourself to the audience and let us know how you joined sports into your career and what you currently do with your practice.
of course. So I'm Mikko Lemettila. Uh, my day-to-day job, I work in a clinic foundation, Finland. So I'm from Finland, and my main responsibility is doping prevention in recreational sports. And that it includes maintaining and developing an anti-doping agreement, which is aimed for the fitness industry, such as gyms and other non-competitive recreational settings. Uh, in addition to that anti-doping agreement, I educate the fitness industry and healthcare professionals about doping in recreational sports. That we developed a sports pharmacy course for the University of Eastern Finland that is currently ongoing for the second time now this semester. It just started last week. Background, so actually my base educational degree is in physical therapy, and then I've contemplated with a diverse range of studies from pharmacy and sports and exercise medicine. And I currently, alongside my full-time work, I study in the International Master's Degree Program in Pharmaceutical Research, Development and Safety. And the question was how I combine sports with my career, I guess. So,
Yeah.
well, my current job description is mostly about health promotion in sports and exercise settings, promoting anti-doping values. So all the sports that I do, or all the educating I do, or all the coaching I do, I try to be a role model of these anti-doping values as well. And from the perspective of my work, uh, I think the anti-doping activities also include creating a safe environment, giving social support for others, being open, giving open communication opportunities, and emphasizing the positive effect of sports.
Yeah.
So if I'm a specialist, I'm also an outdoor cross training coach. I volunteer for the rock climbing community here. So in all of those environments, I try to emphasize these values
Right.
and be a role model. Yeah.
Yeah. Truly athlete support personnel. Yeah,
Yeah.
in so many ways. I mean, living the athlete lifestyle at the same time you're promoting clean sport, and you're one of the first that I ran into in the sports pharmacy community that was really comfortable in talking to me about the way people are actually using performance enhancing substances, because we might cross paths with individuals who aren't going to be tested for doping, and they're using these substances on their own. What Finland is doing, and most of the Nordic region now is doing, is unique in having open conversations and like reference lines that people can actually call to get more information about what they're choosing to do with their use of performance enhancing substances. And we've seen a real shift online to an acceptance because of the social media influence of users being so open with their self-guided tours through steroid use and nootropics and experimenting with drugs is one platform that we can use to open up conversations with our patients as well, or with recreational users. Based on your experiences and the conversations you've had, how do you typically approach that, or what are common topics that you see that might be of use to pharmacists to use in our communication with our patients or our athletes?
Yes. Thank you for that question. It's interesting. Maybe I need to clarify a bit of the context. We're working here in Finland. So, like you said, we approached doping from the public health perspective. So we have the Finnish Center for Integrity Sports that follows the guidelines of WADA and does anti-doping activities in competitive sports, but we approach it from more from public health perspective. And I work in a project called Doping Linkki, which has the anti-doping agreement I mentioned, but we also have health counseling for anabolic steroid users, and then we educate different professionals about doping and its different motives. And also we maintain a data bank about different doping substances. And this is non-profit work, and we're government funded, so we mostly try to, spread the evidence-based data about doping. I agree what you mentioned about the glorifying of steroids of social media influencers, and I think this is a phenomenon, true phenomenon that healthcare professionals should be aware of, mainly because it could potentially influence new people to start using, for example, the youth or people who don't have media literacy skills to identify which is false information and which is real information.
Exactly.
And also the concerning thing is that the algorithms in social media seem to promote that if you consume more content linked to muscle mass growth or bodybuilding, you probably get more exposed to this positive AAS use content as well. All pharmacists and healthcare professionals should be aware of the different motives behind the use. So it's not just competitive sports that drives the use, like performance and the medals in sports, but there's a lot of other motives as well. We approach the topic maybe from a self-enhancement perspective. And if you approach the topic from the self-enhancement in mind, there's multiple reasons for using, for example, performance and image-enhancing drugs, for example, aesthetic reasons, or gaining muscle mass to look more intimidating. Then there's the nootropics you mentioned, so cognitive enhancement to increase working and studying performance. And some people even self-medicate themselves with doping substances because of addiction or mental health issues.
Yeah.
And interestingly, I've explored a bit about or looked into chemsex as well, and I think this kind of falls into the scope of self-enhancement and doping as well. If your motive is to sexually perform better, then you might use doping substances for that too. So it's a really diverse range of different motives there. Keeping in mind that you should be aware of the rules and regulations in your country as well. So like you said, the use of anabolic steroids in Finland is not criminalized. So every sports pharmacist or pharmacist should be aware of their national legislations and other international agreements. For example, in Finland, the use is not prohibited. The doping substances are defined in our penal code, and use is not prohibited, but the distribution and possession for distribution purposes are also, of course, prohibited.
So
but then
the
again,
user who's actually has it for their use just for themselves, it's not criminal for them to actually have it in their possession, but someone who has a larger quantity with the intent to distribute it for non-medical purposes, illegal purposes. Okay. Yeah. So that's still criminal in that way.
Yes. And then again, it depends on the substance you are using. If it's a substance listed in the penal code that is classified as doping substance, for us, it's testosterone, anabolic steroids, and substances that increase the testosterone in the body.
Okay.
For example, tamoxifen and clomifen, those are considered as doping substances. But then again, if you're using amphetamine for doping purposes, then it could fall into the Narcotics Act, and then it is penalized, and you could face jail time as well. Then what is interesting about this special target group, like AAS users, this is a group that usually has a lot of mistrust towards healthcare professionals, and the users tend to share their own information in their networks or their subculture. And there's maybe even a bit of a reason behind it, because even if they try to seek help from healthcare professionals, they might have insufficient knowledge about steroid use or other doping substance use. So even if they would seek help for the cessation of use, the healthcare professionals don't know what to do.
I mean, we're not taught about this in school.
Yeah,
It's still a little bit taboo. It's something that we might learn physiologically what's happening, what is the medicinal chemistry, but we're not learning in the clinical setting what are people actually doing and how are their bodies really responding and what's being discussed with bro science.
first they use the AAS with supraphysiological doses that exceeds the medical dosage, uh, and they usually during the cycle they are combining many different testosterone products or AAS products, and of course polysubstance use can also include other psychoactive drugs use such as alcohol, cannabis,
Yeah.
opioids,
Yeah.
so which are for other purposes such as recreational purposes.
Do they disclose this information to you to tell you what their cycles look like? I'm just curious how you've discovered what these cycles are over the years and what the medications used are.
Yes, sometimes they are, because it's online based
Oh, okay.
health
So there's
counseling, online based health counseling service. So
okay.
they can ask us anonymously and
Oh, got it. Yes.
confidentially about their use. So
Yeah.
they're sometimes quite open what they are using,
Okay. Yeah.
and the
That does help a
adverse,
lot.
yes, and the adverse effects, of course, what they are experiencing. As a healthcare professional, we should fight the misinformation with evidence-based information. So if you run into misinformation, for example, in social media, so you should try to correct that with evidence-based information. And by this, I mean that you don't need to, emphasize or frighten with the adverse effects, but give the objective information. So there are benefits the users are actually experiencing, but there are a lot of adverse effects, especially when you're using multiple substances and with supraphysiological doses.
Yeah.
For prevention techniques, I think you should emphasize the positive effects of sports and exercise. And I think we should criticize this phenomenon from a social perspective as well. So we should criticize maybe the performance pressures and ideals set by our society, because I think doping and self-enhancement in general is a kind of symptom of those set by the society about performance and beauty ideals,
Yeah.
or what's happening in their body, and then they get exposed to this kind of content. So
Yeah. It's I mean it's definitely multifactorial. There's so many different ways we can approach the misuse of medications and this this expectation of what a masculine body should look like or what an athletic body should look like. I've done a lot of testing on AI, telling it to give me a picture of an athlete, and the majority of the time, just using the word athlete without more descriptors about, having a lean athlete or something like that, the athlete will be a bodybuilder. It will be a very muscular male athlete, and unless I tell AI to do something different, that speaks to the images that are out there that AI is drawing from, and again, just reinforces that what's put into our algorithms when people are searching for this, that's the result they get. So it's
yes.
skewed.
And I usually, when I'm educating, the youth or the sports professionals, I tend to ask that how do they feel about the current ideal set for women or male, and
Yeah.
usually they say that maybe from women's side there's a bit more developed, these body positivity movements,
Yeah.
but maybe the man's ideal is still quite narrow. So we
Yeah.
should make it more diverse, all
Yeah.
in all, or in
Yeah.
general, for all
Yeah.
genders.
Yeah. Yep. I would agree with that. I would say I've definitely seen a shift over the last, 10 years or so among women being less critical of other women. And
Yes.
because we're more aware of it, and the same is true for the men, just as you said. I heard a bodybuilder once say, I'm not doing this for anybody else except the person in the mirror. And I was like, then that means we need to work on the inside. There's such a mental health aspect that is going on with that desire and that self drive to look a certain way, or
Mhm.
who are they trying to impress is kind of one of those first questions. No, I don't usually ask it in that way, but that's what I'm trying to get to, and understanding why they're using this and then readdressing what is actually going on with the misuse of whatever drug.
That's a good point, because usually there might be some sort of self-esteem issue behind
Yeah. Yes.
doping substance use.
Yeah.
Or
Yes.
even experiences of bullying or
Mhm.
neglect as a child. So kind
Yeah.
of same motives that are in the addiction field in general.
Because we're also trying to destigmatize the way that we're approaching these conversations with an anabolic steroid user or any performance enhancing drug user, anybody who's trying to, enhance their body image, and approaching it more from the harm reduction approach, which I see positives and negatives to that, because we do need to shift the blame off the person, because it's not just a single issue. But at the same time, harm reduction has pushed us a little bit too far into not holding the individuals accountable. And I think that is somewhat my opinion, but in trying to put these pieces together and come to some middle ground, I've really begun working with addiction specialists and finding that our knowledge is actually a good balance. What do we see happening in with use of performance enhancing drugs, and then how are they going to treat it as an addiction issue? It's been, because as you know, I've been doing some research on what's been termed pharmacoterrorism by some. I think that term might be a little bit misleading. When an individual uses psychoactive drugs and then performs some act of terror, and when the studies are done looking at what drugs are used for those psychoactives, the researchers often include anabolic steroids. And we know that anabolic steroids change behaviors and have, mood dysregulation. And I was wondering if you can describe some of the things that you've seen and that users have anonymously reported to you. What kind of trends do you see? And is roid rage real when it comes to users?
Thank you for the question, and thank you for addressing stigma and harm reduction as well, because that was one point I was about to make in the previous question as well. And I'm addressing the stigma in this pharmacoterrorism question as well. But maybe to add for your previous question, that we as a healthcare professionals should understand our role in finding a balance which is beneficial for each client's health. And for some cases prevention is the best technique, and for some cases harm reduction comes into play. So if we as healthcare professionals should mostly address the topic from the perspective of compassion and non-judgment, interview the client, and if the client has no intention of stopping the use, then maybe harm reduction approach is the best way to go, because the harm reduction might eventually lead to better for maybe a cessation of use or other healthier outcomes. But I understand why you are having these ethical dilemmas there as well. Yes, then about the mood changes of anabolic steroid users and the Pharmacoterrorism Act. So these horrible events that happen. So how we approach this topic, that there definitely are psychological adverse effects related to anabolic steroid use, and it can lead to changes in behavior, and it has been discussed that AAS use could amplify or induce already existing antisocial or impulsive behavior or personality traits, antisocial personality traits. But I think in these pharmacoterrorist acts, it's important to understand that even if there's AAS use involved, there is other comorbid psychopathology behind these events, or other antisocial reckless behavior, problematic drug dependence. And actually, this is the reason that drives the behavioral change and leads to criminal activities and horrible events. So what I'm trying to say, that in most cases, the acts of terror are probably not because of the AAS substance use, but the psychopathology behind. the individual.
Yeah.
And like you said, you addressed stigma, and from our foundation's perspective, this is an important factor to take into account to reduce the stigma of substance abuse, considering both the use of psychoactive substances for recreational and doping purposes. Because I think with every substance abuse, there's often a mental health issue behind the use that could be possibly treated. But we should, of course, discuss the ASU's well-known psychological changes that is happening due to the fact of the suppression of body's own natural testosterone production. Mm-hmm. When users start using, there's usually benefits they first experience, and these benefits come from the supraphysiological doses compared to your own natural testosterone. And these benefits are usually increased self-esteem, increased sex drive, they're feeling more energetic and powerful. And this is also important to take into account because they're probably not just trying to increase their muscle mass, but they might also seek these kind of benefits as well when they start using. When you're using external testosterone or anabolic steroid, the body's own natural testosterone production suppresses. And so, for example, after the cycle, it results to lower testosterone concentrations in the body that leads to the negative psychological effects you're mentioning. So this brings the mood swings, depressions, irritability, aggressiveness. So maybe you could say there's a lot of highs and lows in ASUs.
The highs are really high from the super therapeutic dosing. And then when they stop their cycle, they would then dip below what their baseline had been prior to use, right? And that's when you might see even more mood changes and aggression and feelings of depression and exacerbations of these potential underlying mental health issues, or maybe if they were on the borderline of having those mental health changes, then this might be the thing that pushes them over the edge.
And like you mentioned, addiction medicine, if you look at it from that perspective, they can also be seen as withdrawals. So and it has also been estimated that about a third of AS users has experienced some sort of dependence on the drugs or even problems of addictions. And I think there are also a variety of motives behind the polysubstance use. So they might, experience sleep problems, the mental health issues. They are medicating that with depressants just for fun, recreational use. We're using ecstasy or cannabis or alcohol, or just, the personality is that way that they have a tendency to do all kinds of risk behavior. With pharmacoterrorism acts.
If they have a tendency to be impulsive and take risky behaviors, potentially for some people. I was curious as well, what you've mentioned a lot of different ways that you're approaching some of these side effects that we see. Who are the other healthcare professionals that are in the clinic? Do you have doctors and mental health specialists that are in the clinic as well?
Yes. Or? So that's maybe a good thing to clarify, because we're a foundation. So actually we're doing, project work here, and Doping Link is one government-funded project that has this, online-based.
Yeah.
Then we have the A Clinic that offers, the addiction care services. It's at the commercial side of A Clinic Foundation. But for if you look at the doping substance users group, we don't have this kind of a specialized clinic for doping substance users. But there is one example, for example, in the Nordic countries, that in Norway they have this kind of specialized clinic for doping substance users.
These models, from the Nordic countries are the way that we could best approach this issue. Really, from the public health perspective.
Yeah, you had the question about who is working here for our online service. So we have sports and exercise medicine professionals. We have a team of 3 full-time workers who are answering, and then we also have a doctor to consult in more difficult cases. So we have, and of course we can consult other healthcare professionals as well.
And having these open conversations with our patients, we can actually use that knowledge to benefit others who aren't there yet. Again, we know what these drugs do from the medicinal side of things, but it's the users who say, well, I've experimented with all these different substances and this is what I found worked to help me get me off of, whatever other agent they didn't want to be on anymore, and use it in a treatment pathway.
Yes. Let's hope there is more treatment pathways in the future.
Yeah, exactly. Yep. Yeah.
And universal guidelines for how to stop using.
Yes. Yeah. So I wanted to ask you as well, what do you see about for the future of sports pharmacy and pharmacist involvement in sports and recreational sports specifically? Because there's such a wellness movement and pharmacists aren't directly involved in it, even though we have so much public interface with so much of our community. And there's many, many opportunities for pharmacists to do this and have these discussions. But what do you see as the potential future for pharmacists?
Yes. Thank you. I agree. It's an interesting field, and I'm surprised that we are not that involved yet. So we needed to wait for 2020.
Yeah, right. Exactly. That really did shift everything. It was a true paradigm shift.
Yeah. But I don't know how the pharmacy field has developed in your country. But what I see is that pharmacy in general is now more shifted towards health counseling and from dispensing more towards health counseling. And maybe that's why also sports pharmacy has emerged, because when we also see that there are multiple care groups that are experiencing limited access to treatment, and maybe pharmacy professionals could be one solution to encounter these target groups. And I think that's when sports pharmacy also comes into play. And pharmacists in general are one of the most trusted professionals, which is a great thing. So I think we should get more involved in sports medicine as well. And what I think, this is a really diverse field that the pharmacist can get involved. So I think it's also a growing field. Pharmacists can be, for example, anti-doping promoters. They can specialize in athletes' medicinal treatment. They can keep counseling on nutritional supplements use, evidence-based nutritional supplements use. Even we as healthcare professionals, we can volunteer for the diverse sports community we have. In general, increase the public's physical activity levels, both locally in your local pharmacy or even at national or international policy levels. FIP Global Overviews on sports pharmacy did a good job in mapping and clarifying the pharmacist's role in sports medicine. So I think everyone should look into that document as well. I think you were also involved in this making of this report.
I did a lot of that research. Really trying to understand what pharmacists were currently doing. And, because we could see that shift. The public was demanding that there be more access to wellness and preventing sickness and disease. And the model of sick care is just crumbling because people don't want to wait until they're sick anymore.
Nowadays, people try to find the balance also in between the, medicinal treatment and with other health and well-being choices. If you should increase exercise or eat healthier, so everyone is interested about that balance. And of course, everyone wants to reduce medicine use.
And pharmacists can play a great role in helping people self-treat. What can we manage at home? And, what should we potentially be referring on to a physician's office for a further workup?
Everyone can go to the pharmacy and ask from the pharmacy professional. At least here, it's completely free, mostly. I think it's the same.
It
in
is.
your country as well. The consulting is free, so it's free health education. So we should utilize that as well.
Thank you so much for this conversation today. I really appreciated it. And I hope a lot of pharmacists take this knowledge as a way that they can begin to open up conversations with their patients or just customers who are walking through the store, trying to be one of the voices that is an educated healthcare professional and begin dispelling some of the misinformation that is out there. And thank you so much for your time, and thank you for everybody who is watching today. And please leave any comments below. Thank you.
Yes, thank you from my end as well, and hope this inspires others to get involved in sports and pharmacy as well. Thank you, Ashley, for the interview.
Absolutely.